Hey everyone, and welcome to today's Explainer. I am absolutely thrilled to guide you through this today because we're looking at one of the most fascinating and frankly highly effective tools in modern medicine, subdermal contraceptive implants. We're going to break down exactly what these are, how they work on a chemical level, and precisely how they're administered. So, let's dive right in. Okay, 99%. Just let that number sink in for a second. Over 99% effective. That is the incredible success rate of these discrete little devices when it comes to preventing pregnancy. It is an astonishingly reliable long-term option, and today we're going to figure out exactly why that number is so incredibly high. Here is our quick roadmap for today. We'll start by meeting the implant itself, explore how it actually works, look at the efficacy and timing, step through the clinical insertion procedure, and finally wrap up with contraindications and risks. All right, Section 1, meet the subdermal implant. You know, what's really interesting here is the sheer scale, or rather, the lack of it. Just sitting right there in the palm of a hand, you can see these implants are incredibly small, rod-shaped devices. They're non-biodegradable, and they provide long-acting, highly effective, completely reversible contraception. And honestly, the best part? Once they're safely placed just under the skin of your upper arm, they are virtually invisible. Now, to build a mental map of this landscape, you basically need to know there are two main categories of these implants, and they're defined by the specific type of synthetic progestin they contain. On one side, we've got the levonorgestrel-based implants. You might actually recognize some of these names like Norplant, Jadel, or Sino Implant 2. Then on the other side, we have the etinogestrel implants, most notably Implanon and Nexplanon. So while the brand names and exact formulations differ, their core goal is totally identical. Moving right along to Section 2, how the implants work. So how do these tiny things actually pull this off? Well, whether we're talking about levonorgestrel or ethinogestrel, these synthetic biologically active progestins work through a super powerful dual action mechanism. First, they thicken the cervical mucus. It gets highly viscous, which basically acts as a physical roadblock to stop sperm penetration. Secondly, they work higher up, acting on the hypothalamus and pituitary glands to suppress the surge of luteinizing hormone. No surge means no ovulation. It's a brilliant 1-2 punch. Let's put Implanon in the spotlight for just a second. This single rod is a mere 4 centimeters long and 2 millimeters wide. It's literally the size of a matchstick. But do not let the size fool you. It provides a highly controlled release of ethinogestrel, starting at about 60 to 70 micrograms a day. And that tiny daily dose is enough to protect against pregnancy for up to 3 full years. It is an absolute marvel of sustained drug delivery. Okay, Section 3, efficacy and timing. So when can you actually get one of these? Well, timing is highly specific depending on a patient's current health status. Generally speaking, it should be inserted between days 1 and 5 of the menstrual cycle. It can also go in immediately or 1 week following a miscarriage. Now, for postpartum women, the guidelines branch a bit. If a new mom is not breastfeeding, it can be inserted right away or within 6 weeks. But if she is breastfeeding, she needs to hold off and wait until after that 6-week mark. Which brings us to Section 4, the insertion procedure. How does it actually get in there? First things first, the procedure is strictly aseptic, and patient comfort is a massive priority. The clinician starts by double-checking there are 0 allergies to the implant itself, the antiseptic, or the anesthetic. Then the patient lies comfortably on their back, non-dominant arm flexed at the elbow and turned outward. The whole area gets cleaned up with antiseptic, and a local anesthetic, like a 1% lidocaine, is administered right under the skin so the patient doesn't feel a thing. Now, the absolutely crucial part is finding the exact anatomical safe space. The clinician is looking for the inner side of the upper arm, about 8 to 10 centimeters above the medial epicondyle. You know, that little bony bump on the inside of your elbow? They make 2 little marks with a sterile pen. This acts as a runway to guide the insertion tunnel, guaranteeing the implant sits safely under the skin, far away from any major blood vessels or deep nerves. Next up is prepping the sterile applicator. And this is a really important detail. Before the applicator even touches the patient, the clinician must visually confirm the implant is actually in there. They literally look right into the tip of the needle to make sure that little white cylinder of the implanted rod is sitting there locked and loaded. With the skin pulled taut, it's time for insertion. They insert just the bevel tip of the needle at a very shallow, slight angle. We're talking no greater than 20 degrees. This precise angle is everything because it ensures the needle stays exactly where it needs to be, right in that shallow, subdermal connective tissue, and not a millimeter too deep. Once the tip is securely in, the clinician drops the applicator down so it's completely horizontal. They use a clever technique called tenting. Basically, they physically lift the skin up slightly with the tip of the needle and then gently glide the needle all the way in to its full length. The whole time, they're keeping it perfectly parallel to the surface of the arm. Now for the mechanical release. The clinician breaks the seal of the applicator by pressing the obturator support. Then, to actually unlock the device, they physically turn the obturator, which is the inner plunger part of the device, exactly 90 degrees in either direction. Finally, the drop-off. To leave the rod behind, the clinician holds that inner plunger absolutely still, totally fixed in place, while smoothly sliding the outer needle, the cannula, entirely back. It's essentially like peeling the needle away, leaving that flexible 4-centimeter implant perfectly laid out beneath the skin. Okay, it's in, but we aren't quite done. Immediately after insertion, physical verification is mandatory. Both the clinician and the patient have to palpate, or feel, both ends of that 40-millimeter rod right through the skin. Fun fact, if you can't feel it, an X-ray won't actually help because the rod isn't radio-opaque. You'd have to use an ultrasound or an MRI to find it. Once it's confirmed, a small adhesive bandage goes on, followed by a tight pressure bandage for about 24 hours, just to minimize any bruising. Let's pivot to our final part, Section 5, contraindications and risks. Now, as amazing as this technology is, there are strict contraindications. It is definitely not for everybody. It absolutely cannot be used if there is a suspected pregnancy, a history of thrombosis or blood clots, or any active liver disease or tumors. On top of that, individuals with undiagnosed abnormal genital bleeding, breast cancer, progestin-sensitive cancers, or frankly just allergies to any of the implant's materials are simply not candidates for this method. For those who are candidates, it is still super important to know about the potential systemic side effects. These can range from nausea, stomach cramping, and bloating to neurological symptoms like dizziness or headaches. Some folks experience mood changes or even depression. Other full-body reactions can include breast tenderness, acne, hair loss, or weight gain. Beyond the systemic stuff, there are localized and reproductive side effects to watch for. Changes to your menstrual periods? Yeah, definitely expect those. They are very common. There's also the possibility of vaginal itching or discharge. And locally, right at the insertion site on the arm, patients might notice some temporary bruising, tingling, numbness, or a tiny bit of scarring exactly where the rod was placed. Wow, we have covered a ton of ground today, from that staggering 99% efficacy and the really clever synthetic hormone chemistry, all the way through the meticulous clinical insertion process and the safety guidelines. And hey, while we didn't focus on it today, the similar, highly precise removal procedure makes this entirely reversible, which is a massive factor. So now that you've got this clear, structured breakdown of how subdermal implants work, I leave you with this. Could this highly effective long-term option be the right fit for your unique lifestyle and health history? It's a really fantastic question to take straight to your doctor. Keep learning, keep asking those great questions, and I'll catch you in the next explainer.